Hello, hello, hello. Thank you for joining us today. Thank you for coming in, you JQ cuties. We're about to play some trivia. Are you ready? We got some people signed in here. We got Fourth Though. I think that's Fourth Though. We have SICU, you Corky caregivers on. 18 East, welcome aboard. We have Blue, Captain Weatherwax. Hands off Captain Weatherwax for last week's fantastic DJing of this game. We also have Baby R Us. Or is that Baby Russ? I think it's Baby R Us. So welcome. Hello. This is live to you from Toledo Hospital, the bowels of Toledo Hospital, the basement, the live studio. It's time for us to play JQ Trivia. You can join at Kahoot right now. Your pin is 1107-279. You can join in right now to play with us. We're going to have a lot of fun. So if you're not on, you're not having any fun. That's all I can say. So we'll go ahead and get started. I am your host, Molly Brixey, a.k.a. JQ Diva. How this game works, there's going to be 12 questions. All you have to do is answer those 12 questions. Kind of want to answer them right. You get 30 seconds to answer that question. The faster you answer it, the more points you'll get. The winning team is going to get some bragging rights as well as this JQ trophy. Check that out. And the individuals in the top three will get a certificate. In the unlikely event that we have a tie, we're going to go ahead and give you a general knowledge question. And you will be asking, are you ready, JQTs? Here we go. Use the monitor. Molly, that's what they're telling you. So I'm going to do that. We're going to go ahead and get started. Are you ready for the first question? Here we go. 12 questions. We're about ready to play. So how can you individualize the care plan? How can you individualize that care plan? You look at the patient's problem list, address their admitting diagnosis, talk with the patient about their goals, or all of the above. I'm thinking this should be an easy one, this first one. Once again, we got the red, the blue, the yellow, and the green. Getting some answers in there. Who can get this one right? You guys are kind of going to have to give me an anxiety diagnosis in a little bit. Let's go. Let's get those answers in. So we also have, we got those answers in. Good job, team. Looks like everybody got that one right. Excellent. Sorry, 18 East came in. 18 East, big winners. Your hearts are pretty strong too, right? Because you're cardiac people. Good job. Baby R Us coming in at second. Nice job, Baby R Us. And fourth, though, coming in at third. Captain Weatherwax seems to be coming in last place right now. That seems to be a diagnosis of ineffective answering of questions related to knowledge deficit. And we're going to go ahead and say the desired outcome is still up your game, kids. We got another question coming for you right now. Here we go. You can identify a nursing diagnosis from. How can you get that diagnosis? You can an actual problem the patient experiences, a desire by the patient to improve his or her current health, an identified risk, or all of the above. So again, an actual problem the patient experiences, a desire by the patient to improve their current health, an identified risk, or all of the above. Lock those answers in, JQ cuties, because we got another question coming your way. And this lady's ready to play. And time is up. Oh, looks like someone fell out of that question. 6 of you playing got it right, though. Good job. So it looks like Babies R Us pulled into the lead. Nice job, kiddos. Loving that and making me cry like a baby. Fourth O coming in at second. 8 South coming in at a strong third. 18 East dropping down a little bit. Dropping down, giving me heart palpitations. You know what I'm saying? All right, Captain Weatherwax still at the commanding low lead. So we'll go ahead. You guys ready? Here we go. Another question coming at you. Care plans need. Well, that's pretty broad, isn't it? Care plans need a problem resolved at discharge only, updated every shift, problems added at admission only, or to be left for the next shift. My personal favorite, left for the next shift. Your colleagues would say that's a pretty bad idea. But how many? Here we go. We got some people putting in the answers. Do you know it's actually pizza day today? So for your patients with their nutritional deficits, you can go out and get pizza. But in my house, it's pizza day all the time. So go ahead and get those answers locked in. We got all 6 of you getting it right. Who was the fastest? coming in that lead at 2,300 points. We have Fourtho still staying strong in that second place. We have 18 East coming in at third. Captain Weatherwax, way to go, picking it up. And we have Baby R Us dropping into the bottom. I think really and truly, you guys need to work on this here. So I'm going to go ahead and type in the related to information. Misinterpretation, lack of recall is evidenced by your inaccurate follow through these correct questions. My desired outcome for you really is to verbalize the understanding of the care plan management program. Your interventions really is something you probably need to go back to nursing school. These are kind of easy. Let's go to question 4. In EPIC, individualize the problem by editing the goal, deleting a goal, adding a goal, or all of the above. Editing the goal, adding a goal, deleting a goal, or all of the above. In EPIC, how do you individualize a care plan? You know, in EPIC, we have 5 different care plans we can choose from. We have pain, safety, infection, knowledge deficit, and discharge planning. Those are your care plans that come up automatically. It's your job to be specific and make those individualized to your patients. The other thing you got to do is win this game. 4 of you got this correct. 3 of you got this wrong. That seems to be slightly a savage question. Savage question. Moving on, who came in top? 8 South, you cardiac gurus, you coming in at 3,368 points right now with 18 East. Again, those cardiac nurses seem to be rocking it out. Captain Weatherwax coming in at a good place. Fourtho coming in at 4th, and Corky Caregiver finally joins the board with us. Welcome, Corky Caregiver, coming in at 4th. Your next question, Q5. Care plans are important because red, did they tell the nurse what the tests and procedures do? Yellow, they provide an area to document patient health history. Blue, they provide individualized direction for the patient's care. And green, they tell the ongoing nurse about the patient's day. So why are care plans important? You guys can get this. You know what's interesting? Supposedly it's chocolate day today too. So that means we have pizza day and chocolate day on the same exact day. That's fairly convenient for all of us chocolate pizza lovers for sure. Hey, all 7 of you playing right now got that one right. That's amazing. Good job. Looks like 8 South jumping into the lead. Go ahead, 8 South, 18 East coming in 2nd. Captain Weatherwax coming in 3rd. Fourtho, you're in 4th. Now, your name suggests it. You're Fourtho. Let's go. And then Corky Caregiver coming in at the end. Your next question, Q6. How can you find ancillary departments' care plans? Do you find it by clicking on the care plan and reading the nursing care plan? Do you find it by clicking on the notes and choosing which department notes to review? Do you find it by clicking on the navigator and choosing the ancillary department? Or by calling the ancillary department asking them for the plan? Now, who knows this one? You're going to have to know how to do this. When the Joint Commission comes here, you have to be able to navigate that chart. Can you navigate that chart? Looks like 6 of you sealing in your answers, 2 seconds to go. All righty, what do we have? We have 4 people getting that one right, 4 teams getting that one right, 2 getting that one wrong. Again, you're going to need to know this for Joint Commission on how to navigate that chart. So can you find the other objectives in the chart for Joint Commission? I sure hope so. We'd like it if you could. All right, who got that one right? Cardiac, 18 East, in the lead. 8 South, right underneath. Captain Weatherwax, again in the 3rd. Corky Caregiver coming in 4th. Ortho dropping to 5th. That'd make you 5th row, I think. Q7. Which of these is a measurable goal? Is it the patient's pain will be at a 4 or less on a scale of 1 to 10? The patient will ambulate around the unit. The patient will verbalize decreased pain, or the patient will perform range of motion to prevent contractures. This one should be a fairly easy one. What do we know about measurable goals? We need a couple things to make them measurable. What is that? What is that? 6 of you locking in your answer, 6 seconds to go. What do you think it is, kids? Because I think I know the answer to this one. Whoop, whoop. All 6 of you got it right. We need a measurable outcome out of 10. Let's just say when I'm a patient, can we make it at least like, I want my pain like 0. Is that acceptable to be a 0? I hope so. I know it's not. 18 East coming in again, strong. Coming in at 6,717 points. Good job, 18 East. 8 South coming into the 2nd lead. And Corky Caregiver pulling in the 3rd. Captain Weather Watch dropping to 4, and 4th still in the 5th spot. So nice job, guys. Coming at you. Next QT question. Each adult patient has this many general care plans generated. They need to be individualized. Ooh, someone might have let this answer slip before. Here we go. We have 3, 4, 5, or 6. 3, 4, 5, or 6. So how many care plans? I think someone might have already told you the answer to this one. So where are you guys at? Got 2 people that were listening probably a little bit ago. A couple people maybe not tuning in like they should. That's okay. You don't have to, but we have 6 people locking in their answers right now. And, ooh, savage question again. This one, 4 people missing out on this correct answer. We have 3 people getting it right. Who are those 3 people? Anticipation overload. Who are you? 18 East. My goodness, 18 East. I'm so impressed. I sure hope it's your boss is watching. 8 South. Coming in 2nd, Baby R Us jumping into 3rd place. Nice job, Baby R Us. Moving on, let's see if you still got it. Can 18 East keep this streak going? You have had the highest answer rate for the last 8 questions. That's phenomenal. You should play the probably pick 3 tonight because I'm thinking you're feeling lucky. All right, here we go. Next question, Q9 of 12. This is what we're doing. Your patient may not meet the long-term goal during hospitalization. You should do what? You should not include these goals on the patient's care plan. You should address post-discharge and home care needs. Only include goals they can meet or let someone else deal with it. That's my personal favorite. Let someone else deal with it. You should not do that. That is a bad idea. So what are you going to do? If they're not meeting a goal, I think it's pretty obvious. Some of you met this goal, though. You locked in the correct answer. 6 of you did. 1 of you got that one wrong. Let's see who it is. Here we go. 18 East, still number 1. 8 South coming back with an answer streak of 3 that they got right. Good job, 8 South. Baby R Us, come on. Come on. Those babies need care plans too. You can do this. Corky Caregiver coming in at the 4th. And SICU, where have you been? You entering the leaderboard now on the 5th place here at SICU. So here we go. Who's ready for that next question? Here we go. Joint Commission requires, this is going to be a good one. It's a pretty vague question. Documentation of the patient's progress or lack of it. Documentation of nursing care plans or admission only. At least 10 interventions or 5 nursing diagnoses with 5 interventions for each. So what does a Joint Commission require? A Joint Commission actually dates back a long time ago, and it was a group of standardized organizations that came together to form the Joint Commission to get all of us to be on the same standards. And ironically, they chose the very lowest standards to make sure every hospital meets. So they continue to see the lowest standards, and that's what they set, and we have to reach them. So when we don't, we're not really up on our game now, are we? But I see 5 of you up on your JQ Cutie up on your game. So 5 of you answered this question right. 2 of you answered it wrong. Who's going to be in the leaderboard? 18 East, you're making me sweat. Good job. Babies R Us coming into 2nd. I'm proud of you. Birthing babies and answering questions right. Good job. And 8 South, you're dropping into 3rd. Corky Caregiver going into 4th. And SICU coming in at the last place. Where are you at, Ortho? Did you drop out? Come on, you can get this. Here we go. Who's ready for the next question? Question 11 of 12. Which of these is a specific patient goal? Give plenty of fluids. Encourage fluids 1,500 milliliters day shift, 1,500 milliliters night shift. Encourage fluids every hour. Or encourage the patient to drink water with every hourly check. Who's going to get this one right? Looks like you only have one more question to pull yourself and win this game. So who's going to answer this one? We got 6 people getting this one right. Nicely done. 1 person getting this one wrong. Let's see who's in the leaderboard. Oh, I pushed you quick. You're not going to know until the end. It's going to be a surprise. Here we go. Nursing care plan embody the components of the nursing process, which include assessment, care plan outcomes, evaluation, problems, relating factors, identified risk and evaluations, assessment, diagnosis, planning, implementation, evaluation, problems, plannings, outcomes, and evaluation. Wow, that was a lot of long syllable words in one question. That was your hardest question there. 2 of you got it right. 1 of you got it wrong. I'm about to tell you who took down this game with a severe, wonderful game. Here we go. Standing at the third place is 8 South. Nicely done. Baby R Us, you guys took second place. Good job, Silver. Way to go. And in the gold with a commanding lead the entire game was 18 East. Good job, you JQ cuties. Hope you come back next week. We have a special guest next week. You guys are going to want to see this guy. You see him on TV every once in a while. You're going to see him live right here in our ProMedica Staff Development Studios next Thursday at 11:30. He's going to be here, and you're not going to want to miss that one. So join in and play, even if your unit's not chosen. 18 East will be headed your way with your fantastic trophy that you will be able to display and brag on a whole entire week with your little care plan, knowing that you won this trophy. Good job. The rest of you will be bringing you a certificate around, and we hope you come back next week to play with us. Thanks, guys. Have a good